So my NVIDIA health insurance actually ends at the end of the month. I have another dentist appointment, and I have another, just a checkup, and I'm doing everything to knock it all out. Yeah, break your leg for max value. Watch the Brian David Gilbert video about insurance.
And recently my Cobra insurance ran out, so I used that QLE to look up some HDHPs and PPOs, but ended up going with an average premium HMO health insurance policy. Every word in that sentence burned as it came out of my mouth. That's right, folks. I'm talking about the beautiful American tradition of private health care. Please enjoy this cursory and most likely useless guide to American health insurance terminology.
I love this.
What's health insurance?
Then health insurance should pay for you to get better in the event of an illness or bone break or something terrible.
Yeah, but they don't. If they're private companies and they have to grow every year, and the way you grow is by paying out as little as possible, but charging as much as possible, and people have to do it.
What's dental and vision insurance?
Scientists have researched for dozens of years in order to prove one inimitable truth. Your teeth and your eyes are not a part of your body. And although technically these are separate because dentistry and medicine are considered different fields, and so insurance companies view them differently.
What's a premium?
Ooh, a fancy word. Except it actually just means the fee you pay your provider, usually monthly, in order to keep up your health insurance. But the good news is that if you pay your premium every month, you've got health insurance. And once you've got health insurance, you are set. You never have to worry about paying for healthcare ever again.
What's a deductible?
So you pay your premium every month. That's great. It allows you to carry around a little card that says you're insured, and you can go to the doctor and they'll give you a bill, and you have to pay all of it until you've filled up your deductible. Let's say your deductible is $100. If you go get a medical test that costs $100,
well, this thing's gonna be expired in,
$100.
2 weeks.
But after that, you've fully paid up your deductible, and that means the next time you go get a $100 medical test, your insurance will pay for it. Premium and your deductible are often inversely related. So if you pay very little in premium, your deductible will be way higher. But if you pay a lot every month, your deductible will be small. And this brings me to my favorite part of health insurance, which is... Hello, welcome back, everyone. Welcome back. Do you think you're gonna break your leg this year?
Nope.
No, I wasn't planning on it. Oh, it sounds like you're gonna go with a low premium, high deductible plan that will save you money. Okay, yeah, I don't know what that means, but I'm excited.
I didn't go to the hospital, or to be honest, the dentist in the past 2 years. All right, so I'm paying for nothing. Nah, I'm doing it all now. No, my teeth are good, all right? Actually, I went very recently, got a lot of compliments. I feel like I've got completely screwed on health plan, actually, now that I think about it. Even though it's great health coverage, like I paid some portion of my paycheck, and I never used it. And now it's gone. Now it's gonna be gone.
What are copays and coinsurance?
Congratulations, you finally paid your deductible for this year.
Nice.
Or maybe not congrats, because it probably means you had a lot of unexpected health issues this year, so that test that cost you $100, it might have a $30 copay on it. So if you have no deductible or you've filled up your deductible,
They just decide that at will. Like, is there any kind of method to the madness here, or do they just go like, hey, let's just make that one have a $30 copay or a $50 copay? Or what is the justification? Why? Well, it doesn't make any sense.
And coinsurance? More like coinsure ain't gonna be in your pocket anymore because you're gonna be paying with it. I thought that was gonna be cleaner. Coinsurance is just another way of splitting the cost with your insurer. And it's better for you if the percentage is lower. A $100 test with a 20% coinsurance means you'll be paying $20.
What is the fucking idea of coinsurance? I'm not starting an insurance business with you. We're not in this together. I'm not trying to help you fucking... You pay it because I paid the fucking premiums.
Occasionally, you'll see some things listed as 100% coinsurance, which is a dirty trick. That means you'll be paying 100% of the costs. That's not coinsurance, that's no insurance. But hey, how come I still have to pay things after...
It's 100% co-insurance. We are in this 100% together. You just put up the money and we'll be the insurance. The more I watch this, the more I realize that we actually have the best system. Everyone is in another country. Europeans, Canadians. It's insane that you guys don't have anything like this. It's cringe a little bit.
What are drug tiers?
Yeah, I mean, like, ever since Dinky Smuggies did in regionals, penicillin kind of got nerfed, so I'm gonna put that down in tier 1. Usually it goes generic drugs on tier 1, brand name drugs on tier 2, fancier or non-preferred brand name drugs on tier 3. And once you hit tier 4, you get specialty drugs, which are often very expensive and specific in what they treat. if you want to figure out if a certain drug is a certain tier, you're gonna need to check with your provider's drug formulary. When you go looking for this, you'll most likely find a web page that has dozens of links for each specific insurance plan that will bring you to PDFs that are 100 pages long and have different strengths, but it's still very helpful because, hey, you might get prescribed clarithromycin for your pneumonia, and this PDF will tell you that it is definitely a tier 2 drug, or maybe a tier 3. Oh shit, it might be 4. Again, these drug formularies vary wildly between providers.
Fucking dog shit
that
system!
you need Open enrollment is technically the only time of the year that everyone is allowed to change their health insurance. It usually starts on November 1st and goes until January 15th, although, of course, it varies from state to state.
I've only ever had health insurance through my jobs. What does this mean? You can only enroll in new health insurance between this time period?
I had a qualifying life event, or QLE, which is that my Cobra insurance ran out. There are all kinds of QLEs, like losing a job, having a family member die, or leaving prison. The bonus challenge of QLEs is that they're a little like quick time events in that you need to act quickly in order to actually change your health insurance.
Okay.
I knew my Cobra was running out, so I had 60 days before, but if it's a family member dying, it'll be 60 days after, because if you start looking for new health insurance before, that's hella suspicious, which might
be insane if they caught a murderer because they were looking at health insurance before the murder.
What's in-network versus out-of-network?
Most insurances have a list of providers that are considered in-network, which just means that they work with the insurance company, and the procedures you get.
Especially since moving from NorCal to SoCal and trying to find in-network providers for all this NorCal, Bay Area-based insurance that I got. It's just like there's less options.
You have to be proactive in making sure that your doctors are in network. And sometimes moving to a new place will mean that your insurance doesn't have anyone in network around you.
Yeah!
Half of all emergency ambulance rides are out of network, meaning that even if you have an HMO plan, you'll be paying for all of that ambulance fee, and none of it will count toward your out-of-pocket maximum.
This is a system. This is so scammy and bad, dude. This is ridiculous, is what I would say if I lived in a different country than America, because I'd be so jealous. You pay for ambulance? Bro, ambulance is charged to the nose. Aren't there people that literally refuse to be picked up by ambulances because they know the cost will be too prohibitive? Yeah, it's just Uber, dude. If my leg's broken, give me an Uber. I can control the aux at least. Someone did a study at USC and found that Ubers were both faster and cheaper in many parts of LA than ambulances, and concluded that it was a better option for most non-life-threatening injuries. So, dude, if a ride in a vehicle costs $8,000, they better blow me en route, dude. There's no shot that an ambulance should cost $8,000. Home of the free, baby.
I'm gonna be real with you, this is the part of the video I feel the least comfortable talking about because it combines the two titans of American bureaucracy: healthcare and taxes.
Woo!
And the main reason you would want any of these acronyms is for tax benefits, but it varies based on your employer or the bank.
Those would be the two biggest unlocks for making the average person's life better, is if we had a cleaner, simpler, easier to understand tax system and a cleaner, simpler, easy to understand health system. Not only for saving money on everybody, but the ability to make decisions in your life that are beneficial.
An MSA is similar to an HSA, except with an MSA, you are allowed
What the fuck is he talking about?
IRS!
You screwed up, bucko!
I'm sorry! Okay, but an MSA really is similar to an HSA. It's just that I don't think most of you viewers are even gonna have the opportunity to get one of these, because not only do you need an HDHP, but you also have to be in Medicare. I haven't explained what Medicare is.
What are Medicare and Medicaid?
These two words mean very different things, but they're both government-funded programs related to healthcare. One of the main differences between the two is your eligibility. For Medicaid, your eligibility is based on your modified adjusted gross income. It's a federal program, but it's administered by each state, which means that each state will have its own rules and benefits.
Love that.
There are some mandatory benefits, but the optional ones tend to be on the chopping block if you live in a state that doesn't really care about public spending. Medicare is purely federal, and it's predominantly for people over the age of 65. And then Part C, I've had to pull out of order because it's
so
kind of weird,
complicated.
and it's sometimes called a Medicare Advantage plan.
This is what my grandmother has to deal with. She has to learn all this shit just to live? Why don't they just make it? It's so ridiculous. Everyone's just saying capitalism like it's just capitalism, but other capitalist countries don't necessarily have it this bad. The real problem is lobbying, right? It's like it's the relationship between capital and government. It's the fact that big money has, especially in America more than anywhere else, like such a profound impact over policies. Because Amazon's like the only company that has the capital and muscle to like go to war with the insurance companies. And Amazon's trying to get into healthcare and hopefully make a cheaper option for the average person, which is like sad that has to be the option. But like they're the only ones that could even possibly stand up. And Amazon, Amazon's already scaled back some of their plans. I know they were like talking a big game about it, but it's so difficult. The regulations are like miles deep and it's so entrenched. All of the middlemen that blood sucks. So it's like almost every major problem we have comes back to the fact that lobbying is so prevalent and the ability for big money to buy political power is just like, ugh.
Almost every single thing about health insurance has been obfuscated to make it nearly impossible to get a straight answer. It makes you feel helpless. And after the past few months of researching and writing this video, I'm beginning to think it might be designed that way.
It's kind of fun though. It's kind of like the Dark Souls. If it were easy, it would be baby Animal Crossing boring. You know what I'm saying? I hate when the lore is spoon-fed to you.
Always.
But I think it is true.
For an itemized receipt of procedures and costs if you go to a hospital. It might make the costs.
Bro, can I tell you, this is crazy. The costs are so arbitrary. So I was just at the dentist, right? And I got a cleaning, and then I got this thing for like a gum cleaner that I'm gonna take home. And it cost like an absurd amount of money. It cost like $400. And I was talking to her about it and I was like, all right, doesn't my insurance cover that? And she goes, actually, yada, 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 deductible, whatever. It only covers up to this amount. So you have to pay this. And I was like, that's kind of whack. Like, I haven't even used this insurance like for 2 years. There's no way it covers it. I was like kind of going back and forth with her on it a little bit. And she's like, you know what? I can give you a discount. And I just see her click a button for discount and then types in minus $200. And then it was like, she didn't even care. It was just because she felt like it that day. It made me almost more mad. Then your prices don't matter. It's all just like, if I hadn't argued with you, I would have to pay $200 more. It was so ridiculous. It's ridiculous that they just chunked that in there for no reason, hoping nobody would ask.
If you take a look at lobbying money, health insurance is always one of the top spenders.
Oh, yeah.
Blue Cross Blue Shield, a conglomerate that is responsible for insuring nearly 1/3 of all Americans, consistently spends about $25 million on lobbying a year.
Bro, that's such baby money for the money they get back. It's crazy that everybody has to live in this system for $25 million. Elon Musk wipes his ass with $25 million. He just spent $42 billion on Twitter, which loses money. And we can't get better healthcare because our politicians are so corrupt and so cheap that for $25 million, if they're gonna sell everybody out, at least do it for more money.
The system sucks. And as much as I'd like to be able to talk to someone about this overwhelmed feeling I have, my therapist for the past 4 years actually isn't covered by my new health insurance, so oopsie daisy, I made this video instead. USA. I wonder how other countries do healthcare. I mean, it's a wide array. Like, for example, the country I've been in that had the best healthcare was South Korea. Everything was easy and cheap, and I wasn't even a citizen. Man, it was just awesome. It was just quick, easy, not complicated. Like, that country's a capitalist dystopia. That country has 5 corporations that control like all business in the nation, and they were able to do it. Video related to your dentist story. Here's a 5 minutes from Adam Cotton about healthcare costs are arbitrary.
This IV bag costs less than $1, but she was charged $137. These are real prices.
If you're gonna charge me $137 for a IV bag, it better say Supreme on it. Okay.
We send you thousands of patients every day, so we want half off all your prices.
That explains in-network.
So to please these powerful insurance companies, hospitals cooked up a plan.
I've got it. We'll make up a really high fake price and then give you a discount off that.
Hey.
Here's the really evil part. If you don't have insurance, you actually get charged these fake prices.
Yikes.
Even if you're insured, you can get billed charge master prices if you go out of network.
What's extra about it is that like anytime you would be using an out-of-network doctor or hospital is because it's an emergency. Like you would never choose to pay more. So the only reason you're doing it is because you're so desperate in a health situation that you have to be forced to pay whatever you want, which is why they're f***ing you extra hard.
What do I do?
Honestly, nothing. We need to go to the hospital, so they have no incentive to change how they do business. And politicians have spent decades arguing.
It's insane that both these videos end with a real downer. Both these videos end with what can I do? Nothing really. That was interesting. I will say, bit of a bummer, but it was interesting. But I'm sure all of us will be healthy our entire lives and never, ever, ever need to go to the hospital or the dentist for any reason, and therefore we won't encounter this.